Unfortunately, a person's worst day is a normal day for our crews. And when that emergency strikes, and who knows what it is, they have to be ready for it.
GMR is on healthcare's front lines. The first call in an emergency involving high acuity, life-threatening, and time-sensitive situations.
No one wakes up planning an emergency. Much of what we do is preparing to respond to those unplanned events rapidly, effectively, and with the right tools.
We respond at a moment's notice. We respond as soon as the call comes in, and we deploy the resources that we believe are necessary for that individual that's in need.
GMR is able to match the right clinical response for the patient's condition and provide the appropriate care when it's needed most.
Our crews are ready 24/7, and it's important because they have such a passion for what they do. So that readiness, that ability to be there when there's an emergency is something that's core to what all our caregivers believe in. GMR is the largest emergency and non-emergency ambulance provider in the US, and it's not just actually transporting patients, it's actually taking care of people where they're at.
You know, scale matters in an industry like this because of the investments that are required. When you look at the technology, when you look at the assets, when you look at the equipment, the training, the skill sets of the individuals, it actually takes a certain amount of infrastructure and investment.
Over 60% of the US population resides in a county served by GMR.
And that's where scale really matters with respect to patient care, so that we can get our clinicians operating at the top of their license and their skill set.
As the largest integrated air and ground emergency medical services provider, GMR has a responsibility to improve and redesign EMS. Our extensive scale and logistical expertise ensures we can respond in a moment's notice, responding to 11% of all 911 and 33% of air ambulance calls in the United States.
Every community is different. Some need large ambulance deployment centers with 50 or 100 ambulances. Other communities only need 2 or 3 ambulances. Some need 2 or 3 air ambulances in a large geographic area, some just 1. So our ability is scale and scope of what GMR does allows us to put the resources needed for that community.
When you think about the system, and quite frankly, sadly, the lack of access to the healthcare system, we're it. There are communities in this country, especially in the rural settings, where we are the healthcare system. We're the only access to care for these individuals.
Starting out as an EMT and then as a medic in the early 90s, I could certainly have seen the journey of how EMS has changed. The population's aging, which we all know. The number of actual medical providers is not growing at the same rate as the aging population. So as GMR, we're able to really bridge that gap and expand in a lot of those areas because we've got the technology, we got the innovation, we have the clinical crews that are excited to do that type of work. It's something that's part of your core culture of wanting to help people.
There is no average day in EMS. Our experience and our expertise is driven by the patient populations we see. So for example, in a single day in GMR nationwide, we'll see over 200 critically injured trauma patients that need to go to trauma centers. We'll see over 130 patients who have an acute stroke. We see about 90 cardiac arrests in a day. We know how to manage the population because we manage so many. And that helps to inform all of our practitioners nationwide to do a better job when the science changes and to implement those things that make a difference to a huge number of those patients.
When you want to start helping someone, it becomes a passion that you keep really forever. And those EMTs, those paramedics, those flight nurses, that's what they strive for. And that's why when we end up with phenomenal pilots that come in out of the military or other spots, they're doing the same type of thing as an EMS pilot. They're being able to land who knows where, one day somewhere different than the next.
We operate in 50 states. We respond to a situation almost every 90 seconds. That's just about 6 million patient encounters a year. You think about the number of people that we touch as an organization. And how do you do that? You do that with close to 25,000 clinicians, a team supporting them, with 500 air apparatus, 8,000 ground apparatus, delivering healthcare at a moment's notice anywhere. Why do people call 911? Think about that. It's not because it's just 3 numbers and it's easy. So you call 911 because you need to be taken care of.
We recognize that 30% of all calls do not need to go to an emergency room. So having a nurse navigation system so we can actually navigate patients to their right destination of care is something that's critically important for communities. So those people are not backed up in an emergency room. Those patients can get care right away via nurse call line. And it's been incredibly impactful for communities.
We can have you speak to one of our nurses who's qualified to walk you through what your current dilemma is and maybe get you to a different site of care, an urgent care center, or maybe get you to do something at home while we follow up with you the next day. We've responded to the need.
One of the significant advantages of being the largest in our profession is the gift of being able to experience so many different conditions, so many different patient populations, different environments, and taking that data, that information, and looking at the best approaches, applying the science, applying the best practices from our colleagues to improve the care we provide down the road.
I often remind people those ground and air assets, albeit they mobile, are mobile ICUs. They're miniature, emergency rooms that happen to be either on wheels or on wings or on rotors getting to you.
Be at very large event medical sites, all the large NFL games, NASCAR, IndyCar, Major League Baseball. We're known to be able to do the very large events at scale.
In the event of a large-scale disaster, GMR works with states, the federal government, and health systems to provide care at a moment's notice.
Through our Office of Emergency Management, we're in essence the easy button for a disaster. Whatever type of disaster at a large scale, we deploy within 24 hours of being given a mandate.
GMR can augment local 911 services by providing emergency treatment in the field, providing medical standby for search and rescue, and transporting critical patients from impacted facilities to those with power and water.
GMR, as an organization, saw more out-of-hospital COVID patients than any other single EMS system. As that illness was rapidly developing, we were able to take our lessons learned from experts across the country and apply that in all of our practices nationwide. No one has seen more active shooter event patients than our organization, and we have an obligation to look at that data, to look at how we responded, and to incorporate those lessons learned into our preparation for those next events.
So what's GMR's why? And the why is truly the patient. And for us, that's not a saying that we put up on a poster on a wall. It's what this team lives every day, day in and day out.
As a leader, I thank those employees that are out there every single day, the clinicians that we have across the U.S.
I work here because I'm inspired every day by our caregivers, by our mission, and by the culture.
Thank you to the people that are out there every day for what they do, because what they do is not easy, and I really do believe it's a calling.
There's an art and a science to everything we do. The science is the drugs, the tools, the approaches, the readings, the EKGs. The art is the humanity. It's the connection. We're there to support, to walk them through, and to use that humanity to say, we got you.